think we'll get started. Yeah, thank you so much for joining, everyone. Really great to have you. This is, for those of you who don't know me, my name is Carissa, and I am an account manager at Vitamin Lab. I'm also a certified health coach. But this webinar is something that is really near and dear to my heart because I'm someone who has had migraines most of my life, and I come from a family of migraineurs. So it's something that I've seen a lot of. And within my own coaching practice, I've worked with a lot of migraineurs as well. So spent a lot of time researching, formulating for migraines. So I'm really excited to talk to you about this topic today. For those of you who are still just joining, thanks so much. If you have any questions, please feel free to pop them in the chat, and I will continue to kind of monitor that if you have any questions that come up. So we will start off by just going over sort of what we're going to cover today, just a little overview here. So we're going to start off by covering the basic migraine pathophysiology. So what exactly are the biological processes that lead to migraine? And this is an important kind of foundation just to help inform the migraine protocol. So there's a new protocol in the Vitamin Lab portal called the Migraine Support Protocol. And so we're just going to talk a little bit more about how this protocol specifically targets that migraine pathophysiology that we've covered and how to target it with supplementation. Next, we're going to talk about some supplements that are good to consider with caution. So for some migraineurs, there are some supplements that might make migraineurs worse. And they're not always going to be, worse or better. Some might work either way. So we're just going to cover some of those specifics because, the worst thing is when you're trying to formulate for someone and there's an ingredient that's, causing a flare-up or something. So we'll go over those important ingredients. And then I want to give some special attention to menstrual migraine because this is such a really huge impact for so many migraineurs. There's, a lot of women who struggle with menstrual migraines. And so we're going to spend some extra time talking about how to understand menstrual migraine and how to approach it from a formulating standpoint. And then lastly, we'll just cover some other considerations with migraine. So the migraine support protocol is kind of like your migraine base. And then from there, we can look at other considerations. So if there's specific root causes or specific triggers or other contributing factors, what else can you add to that migraine support protocol to focus more on what your unique patient needs? Because that's the beauty of personalization, is we can personalize every formula to that patient. Okay, so to start off with some of the migraine pathophysiology, I want to start off by saying that the science around migraine is not yet, I guess you could say, complete, and it is constantly evolving. So what I'm going to share today isn't exactly conclusive. We have a lot of supported findings, but the full picture is still being put together. So just sharing kind of what we have and just what we can share in this short webinar today. But what seems to kind of start or be the beginning or very common in many migraineurs is this mitochondrial dysfunction. So in the brain, there's this sort of ATP shortfall, the ATP levels drop, and that energy deficit that happens starts to impair neurons' ability to regulate ion flow. So what this really means is that the neurons become hyperexcitable, or in other words, there's neuronal hyperexcitability. So they essentially lose their balance. So normally there should be a nice balance between excitatory and inhibitory signals or neurotransmitters. And in this case, one specific example being glutamate. So glutamate is this excitatory neurotransmitter that heightens neuronal activity. And then we have like GABA and serotonin, which are normally more calming to help regulate pain and calm. And so the balance is sort of tipped in the skew of these more excitable glutamic neurotransmitters. And this is why so often we see migraineurs are very sensitive to things like light and sound or even lowered stress tolerance, because it's like their brains are really responding to normal stimuli in a heightened way. And from this hyperexcitable state, this can then initiate what's called cortical spreading depression, which is really just a wave of suppressed brain activity. And so this is what's linked to migraine with aura. So in migraine with aura, we often see those visual disturbances that's like one of the most common presentations in migraineurs, and that's because the cortical spreading depression starts in the occipital lobe. But you can have it start anywhere. So some migraineurs might experience problems with speech, problems with like moving their body, tingling in their arm, things like that. And then from there, like post-aura is where the pain phase usually starts. So that's where you get the neurogenic inflammation. So the nervous system, these like pain sensing nerves get activated. So we see things like the release of CGRP or other inflammatory cytokines like TNF-alpha, interleukin-1 beta, substance P. And so that just starts to drive inflammation. And the inflammation is most often, it's really specifically seen in the trigeminal-vascular system. So that's why migraineurs, we get that kind of, it occurs around this sort of band on one side of the head. And then otherwise, vasoinstability. A long time ago, it was thought that migraines are really vasodilation, and that's kind of how we talked about it. We know that's a bit more incomplete now. It seems to be that it more starts with some potentially vasoconstriction, and then to compensate, there's vasodilation. But what we do know is that during that pain phase, there is vasodilation. That's when all of that sort of inflammation, that pounding feeling starts to happen, and that's when you're in that pain phase. And then repeated activation of this whole system is what leads to central sensitization. So over time, the nervous system becomes increasingly responsive to, these stimuli, which leads to more severe and frequent migraines over time, which is why it's so important to, help these patients break that migraine cycle. Again, if you guys have any questions throughout any of these slides, please feel free to help them into the chat. I'm happy to help there. Okay, so next, let's talk about the migraine protocol. So to talk about what I just talked, to target what we just talked about on the previous slide is the migraine support protocol. So this protocol, you can find it when you're formulating for a patient under protocols. You can just type in migraine and it should pop up. So this protocol is going to include a few different things. So we have CoQ10. In the research, there have been dosages ranging from like 100 to 400 milligrams, and the best results have been seen anywhere from like 150 to 300. So 200 is a really nice starting point. And then we have folate, so specifically methylated folate and 400 micrograms. Then we have two forms of magnesium. So in the literature, dosages of 400 to 600 milligrams have been found to be the most studied or the most successful with migraineurs. But considering bowel tolerance is something really important in an all-in-one supplement. So we took it back just a little bit. So starting at 250 milligrams of magnesium glycinate, which is really well tolerated, along with some magnesium L-threonate, which has a great affinity for the brain. And so this is where you can personalize this protocol. You're welcome to increase it if you have a patient who tolerates magnesium well, or maybe you keep it there if you're unsure. But this is a really good starting place for many migraineurs. And we have turmeric. So 500 being a really nice starting place, but you are welcome. If you have a patient who's in a more acute phase, they're in a really bad flare up, they're getting many migraines, you could always increase that if you're wanting extra inflammation support. And then we have some more B vitamins. So we have B12, specifically the methylated form, methylcobalamin, 200 micrograms, which is a nice standard dose, as well as B2. Riboflavin is really well studied in the literature at dosages of 400 milligrams. But because we're using riboflavin 5-phosphate, which is the more bioavailable form, we're able to reduce that dosage so you can save on the capsule count, reduce the capsule count and get the most active form. And then lastly, B6 in the form of P5P, 50 milligrams. Now, coming soon, there will be a Migraine Support Plus. We're going to add basically to this protocol I've just covered some fish oil, which is high in EPA. And dosages for this will be at 1.8 grams, although you could bring it down or up. The literature shows that anywhere from 1.5 to 2 grams is really supportive. So as soon as this is available, we're just bringing this ingredient in. That will be another option for you if you have patients that are more highly motivated or want that extra support. This will increase capsule count and cost, of course, because there's extra ingredients. So just something that you can decide what is best for your patient. Okay, so on these next slides, we're going to talk about how essentially each of those sort of categories or like aspects of migraine pathophysiology is targeted through each of these different supplements that we've included in the protocol. So the first problem we're going to talk about is mitochondrial dysfunction, as we mentioned. So the problem here is there's an impaired energy metabolism. So when that happens, it increases neuronal excitability and cortical spreading depression. So by targeting mitochondrial dysfunction, we're going to help prevent that cascade into triggering migraines. So riboflavin is great because it supports ATP production. And by doing so is going to help to stabilize those neurons and prevent that neuronal hyperexcitability and cortical spreading depression from being triggered. Migraineurs have been shown in the literature to actually have lower levels of riboflavin and impaired riboflavin metabolism. So when they are deficient, riboflavin can be extremely helpful. The results are really good. However, when migraineurs aren't deficient, that's when it's been seen to be a little bit less helpful. So that is something that if you've ever tested for it, that might mean it's, and you know, they have sufficient levels. Maybe it isn't something they necessarily need, but it is very safe and well tolerated. So including that is just a really nice support. In the research, for those migraineurs who were taking that dose of 400 milligrams of riboflavin, or in other words, the more bioavailable form we've included, randomized controlled trials have seen migraine frequency reduced by at least 50%. 50%, sorry. And then CoQ10, which is just a mitochondrial powerhouse, really well supportive for mitochondrial efficiency. And really, again, just going to help to lower that energy deficit that happens right before a migraine. In the research, I found a lot of different studies that supported its use for migraine. One, for example, showed that 61% of participants had a reduction in migraines by 50% over 3 months when using this. And so something I look at when I'm formulating is what's kind of the combined reduction that we can see. You know, if we're looking at CoQ10 alone, maybe has a 50% reduction in migraine, plus we're adding the riboflavin, we're adding magnesium, we're creating this stack that together is going to be much more supportive. And then magnesium, which is probably one of the most well-studied nutrients for migraines, has also seen reductions in anywhere from 41 to 50%, depending on the study. There's numerous studies on magnesium for migraine, but really good success there as well. Like I mentioned, dosages can be a bit higher than we've included. So if you know that your patient has good bowel tolerance for magnesium, please feel free to increase that. And then the reason why magnesium is so important for mitochondrial dysfunction is that it's a really important cofactor for enzymes that are involved in ATP production. So if they don't have enough magnesium, the mitochondria just can't produce energy efficiently. And similar to riboflavin, there's research that shows migraineurs tend to have lower levels of magnesium. And when they are deficient, they do seem to have more severe and more frequent migraines. One of the cool things that magnesium does is it regulates neuronal hyperexcitability, that kind of next stage after mitochondrial dysfunction as well, because it helps to block NMDA, which is a glutamate receptor. So blocking that excitability too. So it acts in multiple ways here. Okay, so next we're going to talk about that sort of neurotransmitter balance piece when it comes to migraines. So the problem here being low GABA and serotonin and high glutamate, which increases that brain excitability and migraine risk. I am simplifying a bit here. There are other neurotransmitters involved like norepinephrine and dopamine, but we're just keeping it simple for this webinar today. But as I mentioned, one of the key reasons the brain becomes hyperexcitable in migraines is because of an imbalance of neurotransmitters. So too much excitatory glutamate, not enough GABA and serotonin. And B6 is really cool because it's a really important cofactor in the conversion of glutamate into GABA, which I find so cool. You know, we've got this imbalance. We don't want too much of this, too little of that, and actually helps with that conversion. B6 also helps with the conversion of 5-HTP into serotonin, so supporting healthy serotonin levels as well. So without enough B6, this conversion is impaired. So it's going to lead to that excess glutamate and overstimulation, as well as reduced calming signals. So we really want to make sure that patients with migraine are getting enough B6 to help support those healthy levels of neurotransmitters. And then we've also included methylated B vitamins here. So I'm going to kind of talk about folate and vitamin B12 or B9 and B12 together in the context of migraines because they're both really important for methylation. So there are studies that show that 40 to 60% of migraineurs carry one or more of the MTHFR genes or gene variations. So they often need that extra support when it comes to methylation. So, you know, when methylation is impaired, it disrupts neurotransmitter metabolism. So that can also contribute to those neurotransmitter imbalances related to like serotonin, dopamine, norepinephrine. I know I've been giving special attention to glutamate and GABA, but yeah, those other transmitters are also really important for migraine. Dopamine and norepinephrine just kind of contribute to that excitability in the brain. And then this is kind of unrelated to neurotransmitters, but also important for migraineurs is if methylation is impaired, that can lead to high levels of homocysteine, which can also worsen inflammation and increase oxidative stress, irritate blood vessels. So we definitely don't want that for our migraine patients either. Then again, magnesium, I already kind of mentioned this on the previous slide, but it's going to help block glutamate and support GABA. So together, all of these nutrients are really going to help support healthy balance of neurotransmitters to help reduce that neuroexcitability and lower the chance of triggering a migraine attack. Okay, so next is neurogenic inflammation. So this is very much related to that pain phase of migraine. I would argue the worst phase of a migraine. But yeah, the problem being here, there's elevated levels of inflammatory chemicals like CGRP, inflammatory cytokines, and that's all going to drive this phase of inflammation. So curcumin was the first thing I wanted to add to this protocol because it is so well supportive for inflammation. And curcumin is really cool because it acts in a few different ways. So it directly inhibits pro-inflammatory cytokines like TNF-alpha and interleukin-1 beta. So that helps to reduce the inflammatory response that occurs and calm that neurogenic inflammation. And specifically, it blocks the COX-2 pathway, I guess. So that's like the enzyme that produces prostaglandins. And that's very similar to the way that ibuprofen works. So that's super cool that we can find that in a natural alternative. And then curcumin also has been shown to reduce levels of CGRP. And for those of you who aren't familiar with CGRP, it's been really well studied now. There's actually a lot of new migraine medications that work on CGRP that are getting a lot of success. So this is kind of a cool one to highlight, that curcumin will help to reduce it. And then, so I've included fish oil here. Again, this isn't included in the base migraine support protocol, and it is coming soon ingredient, but we will add that protocol once it is available in the portal. But the fish oil I'm speaking of specifically is the one that's high in EPA. And this is because EPA helps to produce or it provides a source of resolvins, which are really cool because rather than inhibiting inflammation, it actively resolves inflammation by clearing out inflammatory cells. It also helps to repair damage or inflamed tissue and actually signals to the immune system to stop making that inflammation. So it's also in a different way going to help to lower those inflammatory markers. And high EPA fish oil is also good at calming vascular inflammation, which is really specific to migraine. So super helpful there. And then the coolest thing I found is that there are some studies that show that there's a really synergistic effect when curcumin and fish oil are combined, which suggests that they work better when combined. This might be because curcumin can be enhanced when it's combined with an oil, and also because they work in different ways. So they're both combating inflammation in sort of complementary but different ways. And then lastly, magnesium helps to curb neurogenic inflammation because it blocks the calcium flow in nerve cells. So this helps to reduce the sort of like cascade of inflammatory neuropeptides that occur, like CGRP and substance P. So by controlling that process, magnesium will also help to calm down that sort of nerve-driven inflammation in that trigeminal vascular system. And so by calming that will just over time help to break that pain cycle and reduce that central sensitization that occurs. Okay, so next I'm going to go through 2 slides that cover ingredients that are good to consider with caution with migraine patients. So this doesn't mean that they will for sure cause a migraine in your patients. For some patients, they may tolerate them well. For some, they may even get a benefit from them, but there are ingredients that could potentially trigger migraine. So just good to consider with caution. And I'll kind of lump these into different categories. So one being our vasodilators, because there's that vasodilatory component of migraine. Anything that has a strong vasodilatory effect can be a pretty significant trigger. So your L-arginine, your niacin, lion's mane, ginkgo biloba, and they all have different strengths too, so they may not have the same affinity. Like arginine, I find, is one of the stronger ones, whereas ginkgo in a lower dose, might be okay. GABA and valerian, I think, are probably less so, but they still can have a bit of an effect for some migraineurs that I've seen. And then in contrast, we have your vasoconstrictors. So relevant to what we have in the portal would be caffeine. Caffeine is a tricky one, and it's really interesting because in an acute phase, early on in a migraine attack, some caffeine can actually work really well to abort a migraine because of its vasoconstrictive effects. However, taken often, it can either lead to rebounds, which can trigger migraines, as well as just promote more vascular instability, as well as that constriction piece. So sometimes just the constriction itself can trigger, tension headaches, which can trigger more inflammation, which can trigger migraines. So it's just something that can be really tricky. And if you're going to use it, you want to be very consistent with the caffeine. And in lower doses. Pardon me. Next, serotonergic compounds. So this is your 5-HTP, your SAMe, L-tryptophan, St. John's wort. Now, these ones are really interesting because migraines or people who have migraines can sometimes struggle with low serotonin. So the obvious thing to do here is to support healthy serotonin levels. And for many migraineurs, these ingredients can be supportive. 5-HTP notably is really helpful for people who have migraines. However, they can kind of go the other direction for some people. And it seems to be really unique to the individual. And part of what might be going on here is just that drop. So we're supplementing with serotonergic compounds. And then after taking them, there is this drop in serotonin, and it's the drop that is the triggering effect. So just some ones to consider with caution if you've given that to a patient and you're seeing that they are worsening or getting more migraines. Okay, then we have our amino acids. So amino acids in the context of coming from a whole food source generally are not problematic. So if someone's eating eggs, meat, whole food sources of amino acids, those generally aren't problematic. What I'm speaking to is just amino acids that are like isolated or hydrolyzed or in like a protein powder or something like that. So tyrosine and phenylalanine, these are problematic for migraineurs just because they can be quite stimulating. They can be quite contribute to some of that hyperstimulation. So those can be good ones to avoid. Histidine, this is problematic just because of its conversion into histamine. So a lot of migraineurs can be very sensitive to histamine because it does vasodilate. It can contribute to inflammation. So that's one that can be problematic. And then L-arginine, we already mentioned this on the previous slide, as it is an amino acid. I also wanted to include it here, but just it can be a strong vasodilator. And then glutamine. So I personally love glutamine. It's it's such a great support for the for gut health. And I have seen many migraineurs who have tolerated it, but because it can convert into glutamate, it can be problematic for some migraineurs. So just want to proceed with caution. And then collagen is actually for a similar reason. So because of the free glutamic acid, it can also just not help. It's not helping, but it can also increase glutamate. And so just we don't really want to increase that glutamate to GABA ratio because that'll overstimulate, as we mentioned. And then lastly, certain probiotics. So certain probiotics are histamine liberators, so they're going to promote the liberation of histamine. And some of those notable ones that we do include in the portal are Lactobacillus casei, reuteri, and bulgaricus. Hope I said those right, bulgaricus. So just some ones that you might want to consider with caution. We do have a lot of other great probiotic strains that you can include. For example, Lactobacillus plantarum is really helps with histamine, and it is lower in inflammation. So that's a great one to include instead. Okay. So as I mentioned, I wanted to give some special attention to covering menstrual migraines specifically because it affects so many women so strongly. And so I've broken it down into kind of 3 categories, and this is by no means that they occur in separation. Often they can occur together, but they could kind of occur in isolation as well. So estrogen dominance. So the reason why patients who have estrogen dominance experience stronger menstrual migraines is largely due to the steeper drop in estrogen levels. So patients who have estrogen dominance, typically close to the menstrual cycle, there's a drop in progesterone and a steeper drop in estrogen. And when estrogen drops, serotonin drops. And so it's that drop in serotonin that can trigger a migraine. So that's something we want to avoid by addressing estrogen dominance. Estrogen dominance can also increase prostaglandin and CGRP production. So in short, increases inflammation, as well as increases the sensitization of those blood vessels and nerves. So definitely not helpful for those who have migraines. And somewhat related, but this could, of course, occur without estrogen dominance, is prostaglandin. So during the menstrual cycle, prostaglandin levels do seem to rise. That's often attributed to things like painful cramps, tender or sore breasts, and menstrual migraines. And so treating those prostaglandins can be really supportive here. Prostaglandins regulate inflammation, or they're like a type of inflammatory molecule, and they're really well known to influence blood vessel function and sensitizing nerve endings and essentially increasing the perception of pain. And then lastly, we want to support healthy progesterone balance because progesterone is so good at calming and stabilizing the brain and blood vessels and things. So when it's low, it can contribute to that increased excitability of the brain and the sensitivity of blood vessels. And often when we see estrogen dominance, we're seeing lowered progesterone. So when we're treating one of those, we're often treating both. Pardon me. Okay, so these next ingredients here aren't a part of the core migraine support protocol, the migraine support protocol in the Vitamin Lab portal. These are all ingredients that you would want to add on their own to support your unique patient's needs. Okay, so to start off with addressing estrogen dominance, we have DIM and sulforaphane. Sulforaphane would be a constituent in broccoli powder. And those two specifically support phase 1 of liver detoxification. And so they're going to help to convert estrogen into essentially safer metabolites. And then we have calcium D-glucarate. This is really helpful with phase 3 of detox, so essentially the elimination stage of detox, and it helps estrogen from being reabsorbed in the system. And then we have EGCG and pomegranate. Both of them support phase 1 and phase 2 liver detox, and pomegranate specifically can also help to modulate estrogen receptor sensitivity. So it's kind of like turning down the volume on the more overstimulating types of estrogen signals. But in general, all of these ingredients here to address estrogen dominance do support all of the phases of estrogen detox to help with proper elimination, reduce the risk of estrogen buildup that can contribute to that increased migraine sensitivity and those hormonal migraines. And then we have support for modulating prostaglandins. So vitamin E and ginger, those are going to work together to inhibit the production of prostaglandins. They don't certainly, you could include them separately. They don't have to work together. They just work similarly. They both work on the COX pathway to help to reduce those prostaglandins. And then omega-3 is pretty cool because rather than inhibiting the production of prostaglandins, prostaglandins often use omega-6s to produce prostaglandins, but in that case, they would use omega-3 to produce prostaglandins. And when it does that, it produces a form of prostaglandin that's less inflammatory. And then omega-3s also reduce inflammation as well. So you get a much lower inflammation. And then lastly, magnesium, I guess it's pretty similar to vitamin E and ginger, but it helps to reduce the production of prostaglandins as well. And then lastly, we want to support healthy progesterone balance. So chasteberry or Vitex is a really good ingredient that you could include because it helps to reduce prolactin. So when prolactin levels are high, it can suppress progesterone levels. So Vitex can be a really helpful support there. Okay, this last slide here really is just going to go over other considerations for migraine. So what we've covered so far is not necessarily exhaustive. There are a lot of different things you can do to support your migraine patients by adding on to that base formulation. And you can really just like tailor it to each patient's needs. So that's the beauty of personalization in the portal. So oxidative stress, if you wanted to address that, some really good supports include things like glutathione, NAC, as well as vitamin C, E, ALA, and CoQ10. So just supporting that oxidative stress pathway. Otherwise, toxin loads. So a lot of migraineurs are often taking a lot of medications. Maybe before they're coming to see you from a more holistic approach, they're taking a lot of Advil, a lot of Tylenol, maybe they're taking triptans, which can all have a heavy burden on the liver. And when we have more of a liver burden, typically we see migraineurs have more sensitivity to environmental triggers. So perfumes, different things in their environment, or like additives to their food. So supporting the liver can be really helpful here. Vitamin Lab has a really nice liver support protocol that is already really well balanced. So adding that to any of your migraine patients' formulas, especially if they've taken a lot of medications, can be really great here. Then looking at histamine. So a lot of migraineurs are really affected by histamine. So this includes a lot of foods that are fermented, certain probiotics. It can also include histamine in the environment. So seasonal allergies, during allergy season, a lot of migraineurs have a really hard time. So supporting lowering histamine can be really supportive here. There's also a lot of patients who have an overlap with mast cell activation. A lot of patients who struggle with that tend to get migraines. So looking at ingredients like quercetin, the one in the portal that we have is a phytosomal form, which is really effective. So that's a really nice ingredient to include if your patients are struggling with high histamine or sensitivity to histamine, as well as vitamin C. Yeah, you could also include things like NAC, glutathione, bromelain, or even nettle, which nettle has quercetin in it. So I just love starting with quercetin right at the source. And then blood sugar imbalance. So this goes both ways. So patients who struggle with high blood sugar, those moments of high blood sugar tend to be a significant trigger. So for your sweet tooth patients, supporting those healthy blood sugar balance, supporting healthy blood sugar balance can be really helpful. We do have a really nice blood sugar balance protocol already in the portal. So you could look at adding that protocol. And you could also look at adding just some of the ingredients from that protocol. So let's say you add it and you're finding the capsule count is just too high. You've got maybe a few too many ingredients. You could always add part of that protocol and just get rid of a few ingredients. And then low blood sugar is a very significant trigger, one that I've seen a lot more in my coaching practice with patients, or coaching clients, I guess I should say. And so this is obviously going to need a dietary approach to support it, but you'd want to look at that adrenal support, liver support, as I already mentioned, which can help patients become more resilient to those dips in blood sugar. And then iron deficiency. So of course, if your patients have healthy levels of iron, then that's wonderful. A lot of migraineurs, especially women who are currently menstruating, do seem to have iron deficiency that contributes. So trying to get those levels up is really supportive. We have a great add-on that includes a lot of the cofactors, so vitamin C, B12, etc. So you can always look at adding that on as well. It's no surprise, I'm sure, to any of you, but stress is a really significant trigger of migraines as well. So we have a lot of great ingredients there for support. If you are in the portal and you go to categories, you click on categories when you're adding the ingredients, there's a category called stress, and you could just click on that and it'll pull up all the ingredients that are supportive to stress. I just wanted to add a couple mentions here. So ashwagandha, we have sensoril, which is a really potent form of ashwagandha. And then we also have a vitamin lab adrenal adapt for those patients who do need that adrenal support. And then sleep quality. Sleep is a very common trigger for migraineurs. So we have a sleep support protocol that is a great addition as well. And then these last three here are really just supporting those pathways that I talked about earlier. So just some extra considerations of things you could add if you want to sort of boost or enhance your protocol. So for mitochondrial support, some extras that you could add in are things like creatine, NAC, or alpha lipoic acid. If you wanted extra inflammation support, you could look at adding in boswellia. I already mentioned quercetin, but also ginger. And then to support that neuronal excitability, some other ingredients that are really helpful include things like phosphatidylserine, GABA, which I've mentioned with an asterisk, just because it can, for some migraineurs, have a bit too much of like a vasodilatory effect. However, it is pretty mild. So for some patients, it can be wonderful. And then taurine as well as passion flower. So you can treat this list yeah, sort of like a checklist to look at, have I considered these other options? Is there anything here I want to add to enhance the migraine support protocol for my patient? Or if there's, yeah, and by no means is this list exhaustive, but just wanted to provide other options that you can use to truly personalize, because that is, the beauty of having a personalized supplement. All right. So that is it for today. And now we can dive into questions. If anyone has any, you can just pop them into the chat. Okay. I'll give everyone a couple more minutes if they do have any questions. But if we don't have any, no problem. It was great having you all. And again, my name is Carissa. I'm an account manager at Vitamin Lab. If you do have questions about formulating for migraines for your patients, you can reach out to practitioners at getvitaminlab.com, and we can always help get on a call with you and help you formulate for those patients and dive a little bit deeper. Okay. Doesn't look like we have any questions. So thank you so much, and we'll see you on the next webinar.